So here's an anterior view of the right shoulder. What we're seeing here is the subscapularis tendon inserting on the lesser tubercle, the long head of the biceps. This is representing the coracohumeral ligament with its two bands, medial and lateral. And then you can see a coracoacromial ligament. And then this little blue ligament on top is stabilizing the clavicle to the acromion. So our supra and infra are seen a little more posteriorly if we rotate the shoulder. So this is the supraspinatus, infraspinatus, and the teres minor tendon would be inserting here. And what a bursa does is help all the rotator cuff tendons to glide underneath the acromion. So if you have a look here, the superior surface of the supraspinatus is in direct contact with the acromion. So every time the arm elevates and moves, the supraspinatus rubs up underneath the acromion, and it can even impinge or pinch up under there. So something to protect it is the bursa. So think of a bursa like a little fluid sac. So here's just a tiny little plastic snap-lock bag. You can see how thin it is. And when it's full of fluid, it slips and slides very easily. So you're not really going to see a bursa when it's normal, but imagine that sitting up underneath the acromion. And so that every time the arm elevates, the bursa slips and slides really easily. So the two layers of that bursa easily move in relation to one another because it's just a thin, runny, viscous motor oil. But then imagine over time the increased friction leads to that bursal fluid becoming thick and gunky like a dirty motor oil. So instead of fluid, imagine now we've got toothpaste between the two layers of the bursa. So toothpaste is going to move differently to fluid. You can see the two layers sort of stick together and it's not as freely moving. So the fluid is sort of thicker and gunkier. So imagine that now between the supraspinatus and the acromion. And every time the arm is abducted or elevated, instead of the fluid moving freely underneath and squishing and squelching easily, it sort of bunches up. So if we bunch all the gunk to one end out the side, as the humeral head moves up in the socket, the arm starts to abduct. That toothpaste all squishes out the side and now it's thicker. See how it's bunching up under the acromion? So runny fluid won't do that. Runny fluid will just easily glide and slide around underneath that acromion. So here's just nice runny fluid. It slips and slides easily without bunching. Now imagine a stage beyond that. So very chronic bursitis, it's been around for a long time, is worse than toothpaste. It's almost like having grit in between the two layers. So in this case, I've put cornflakes and treacle just to show you how these two layers no longer want to slide opposed to one another. So the two layers of the bursa can't slip and slide relative to one another. They just stay put. So imagine a mixture of toothpaste and cornflakes, you know, like road tar, and that's chronic bursitis. So it's very painful because if you imagine that that's in between the supraspinatus and the acromion, every time the arm elevates now, it doesn't slide, it just jams. And so you get all this crunching, popping feeling as people elevate their arm, and it just doesn't abduct at all. So people have a very limited range of motion when they're suffering from chronic bursitis. And that's why quite often what they get referred for is a injection into the bursa. So because the bursa is so thin, it's only 1 mil thick, sometimes you need ultrasound to guide the needle into the bursa to make sure that we don't go too deep and inject into a tendon, or worse, hit the bone with the needle, which is very painful. So there's an analogy just to help you understand bursitis. There's varying degrees of it. We start off life obviously with really clean bursas, runny fluid, with these 2 layers slide very easily relative to one another. And people that perform, repetitive sports or have chronic poor mechanics of their shoulder where their posture's really poor, and have jobs where they're spending a long period of time performing repetitive movements, sometimes end up with bursas that are a bit more like cornflakes and sticky treacle.